Poso maoni wiak, waiwanan kitanan ni mua e yoski piataya posnotaman e yum MITW Podcast. A yospis piataya posnapi notaman e ne hisikimaka e yoso matnamin e hakihi.
Welcome to the Menominee Indian Tribe of Wisconsin podcast. We are your hosts, Gary Dodge
and Sheena Mapus. On this episode, we are again joined by guest Vaughn Bowles, Public Information Officer for the Menominee Indian Tribe of Wisconsin. I would like to remind people that we request that you send in your COVID-19 related questions into us at podcast@mitw.org. Welcome, Vaughn.
Hey, thanks, guys.
So, Vaughn, recently you've sent out a PSA from Dr. Slagle, and in that PSA, she spoke about reinfection in the community. Is there like a rule of thumb that people should follow for that?
As far as immunity goes right now, we have had someone that may either have gotten reinfected with COVID-19 or had a resurgence of symptoms. Right now, there aren't many hard and fast rules for COVID, but if someone has had it, we're not sure because there isn't a lot of hard data right now about reinfection, and so assume there is a possibility for reinfection, and take similar precautions as if you have not had it yet. Wear masks, physically distance yourself, and take the possibility of reinfection as something that is a possible outcome given the situation and the fact that there are multiple strains of COVID-19 out there. You can be reinfected. So take precautions. Don't say I've got it, I'm immune, I'm fine, and go skipping down the road. Remember, you could get it again, and you could also spread it to other people. So yeah, keep those points in mind.
Also, in that same PSA, she talked about protecting elders and chronically ill. What are some steps that we can take help protect our more vulnerable friends and relatives?
So very much like combating any sort of virus, you want to keep your environment clean the high frequency areas and items that get touched a lot: doorknobs, phones, refrigerators, restrooms, anything like that should be cleaned on a regular basis to help decrease any sort of infection. Again, CDC and multiple health organizations are still recommending the usage of masks. If you can, use something along an N95, KN95, but if not, use a cloth mask. Also recommended is physical distancing, stay more than 6 feet apart. If you keep those in mind, that does help a lot of people. Right now, we have a lot of people in our community that live with elders. If you live with your elderly people, you want to try to limit your exposure to the outside. Keep things simple. Go to work, get groceries, hunt by yourself. Do introverted types of activities, but just limit your time to individuals outside of your immediate household, and treat going out kind of like a hazmat situation. If you come back, consider showering off, just to make sure you aren't carrying anything back into your house. If you don't live with elderly relatives, think about who you might be coming into contact with or spending time with, because those individuals may have elderly individuals in their household. So, think a couple orders of magnitude away from yourself to help prevent, infecting the elderly.
So kind of going along with that same question, we do have isolation homes that are available for people to use.
Right.
From the tribe, correct?
Right, correct.
Are those being utilized?
Yeah, right now we have 3 facilities that we're using with the tribe for isolation. All 3 of them are in use. I believe all 3 of them are at maximum capacity right now. So we're trying to limit the spread of COVID through the use of those isolation facilities as much as possible. So yes, we do have them. Yes, they are being used.
Why should people wait for a few days after they've been exposed to get tested, and how long do they need to wait?
Yeah, this is something we've talked about a couple times, but it definitely can be reviewed. When you were first infected, there's something called a viral load inside of your body. It's just the volume of viral particles that are in the bloodstream and whatnot. And it takes several days for the test to be able to pick that load up. They're only so sensitive. And so on a regular basis, we tell people if you have been exposed, you'll want to wait between 4 and 6 days before getting tested. That way, your body will have enough virus to give an accurate account of the virus within your body. If you get tested before that, it's going to come back negative, whether you have it or not, because the test is only so sensitive. And so we usually have people wait a few days, like I said, 4 to 6, before getting tested, and that'll give you a more accurate picture of if you have the virus or not.
Okay, and then why are some people getting rapid tests and other people have to get theirs sent out? And then can you kind of explain the difference between the tests?
Yeah, so if I was my big brother, I'd say because we like some people more than others, but that's just not the case. So what we have going on is it's basically a question of supply at this time. We have a limited number of rapid tests that come into the clinic from Indian Health Services, and they also have a very specific and limited runtime. The manufacturer recommends that when you get sampled for a rapid test, that it's run within 1 hour of sampling. Otherwise, it basically invalidates the test results. So we can only run 8 of those tests per hour. That said, the clinic is running between 12 and 24 tests per hour, and we just don't have that many tests, so not everyone can get a rapid test. It's not that we dislike or prefer individuals. We would love to be able to give a rapid test to everyone. So it's just we don't. We just run out. So who we're using rapid tests for this time is individuals with active symptoms who haven't been quarantined. Those are our first priorities, and the reason for that is if those people are experiencing symptoms and they're experiencing viral shed at that time, and we want to find out whether those individuals need to be isolated or quarantined as quickly as possible, so we can kind of sequester them out of the community and protect the community as quickly as possible. If regardless of whether you got a rapid test or not, the results would be the same. You'd be asked to either isolate or quarantine, and so really we're trying to use those as an effective means of keeping the public safe. Everyone else, whether you get the rapid test or the test that's sent out, you're going to be isolated if you're positive. We're asking you to isolate if you're positive. So just a limited supply. We wish we could do more. So that's why not everyone's getting the rapid test.
Is there a safe way for families to celebrate Thanksgiving together this year?
The CDC has actually got a great page on recommendations regarding Thanksgiving and family get-togethers this year. Some of the things that they recommend is, if you are going to get together family members, one way to limit, possible spread of viruses is bring your own, food, drinks, plates, cups, and utensils. Wear masks when you come and go. If you're eating, store your masks so they don't get spilled on, because masks become significantly less effective if they're wet. They also say avoid high-frequency areas where food is prepared, like the kitchen, and use single option packets of dressings and things like that. Also consider using disposable containers for food, paper plates, plastic utensils, things that don't have to be washed or reused. Simply just used and tossed. That'll limit everyone's exposure to how much bacteria and viruses can be shared. If you're hosting, some of the other things they talk about, and this may work slightly better in warmer climates, is having your meal outdoors, or with just friends and family that are just in your immediate local community and stuff. That way there's not transfer of viruses across state lines or county lines, and you're not bringing together new potential contacts and stuff for the virus. They also recommend keeping your group numbers small, limiting it to 10 or less. have conversations beforehand with your family members. Talk about the need to social distance, the need to keep things clean, and the need to disinfect those surfaces that we talked about earlier. If you are going to be sharing food, they suggest having one person do the serving with those single-use type utensils. And the last recommendation they make that is probably the safest, if you want to get together, there's always the option of having a virtual Thanksgiving. Technology's moved a long way. You could do Skype calls, Zoom calls, Facebook, Google. There are lots of options out there. And if you get together virtually, you can't exchange hugs, but in the same note, you can't exchange viruses either. So that's the safest one that they would recommend. So those are some of the things we can do for the holidays.
Is there anything else you'd like to add?
There's a lot of stress caused by this situation right now, especially with the spread that we've had on the reservation. But if we continue to take the steps that have been recommended all along, we can decrease the amount of COVID spread in the community, and that'll save lives in the end. And we really appreciate your help, because we really are partnering together as family and communities to make sure we can all stay safe and healthy. So thank you for considering the recommendations and following them to the best of your ability.
Waiwanan for listening to the Menominee Indian Tribe of Wisconsin podcast. You can find us on Apple Podcasts, Spotify, and Stitcher. You can also listen to the podcast on menominee-nsn.gov under the Community tab. Keep up to date by following us on Facebook at MITW Podcast. We do weekly updates with Vaughn and welcome any community questions you have regarding COVID-19. Please send them in to us via email at podcast@mitw.org.